Hi guys, this is me Gayatri Ekal and welcome to QualityOET. So here I would like to discuss with you all about 19th of August 2023 OET exam, in which I'm going to detailedly discuss about OET writing. So there were two letters asked and one is a known case letter and another one is unknown case letter. So let's move on to the case note. So first case note is the unknown case letter. So here a nurse is writing a letter to a social worker regarding a patient condition. So I'm not quite sure about the patient name. So we just consider the patient name as Mr. X. And here the patient is 21 years old. So patient has a history of autistic disorder since 2002 and the patient is on medication for the same. And apart from that, patient has a severe family history of multiple sclerosis and his father recently died because of the hypothyroid problem. And since then, patient is not really getting well on with his condition and his lifestyle because patient is very anxious and much concerned about his father's death. Apart from that, patient suffering with ADHD also. So the January 1st, 2nd of January, patient visited the clinic. So when he visited the clinic, he presented with the complaints of agitation and he was repeatedly saying to the nurse about his father's death. And apart from that, he was so anxious. Thereby, he has undergone blood investigation and a urine test. And he came back to the clinic on 9th of January. That was a second visit to the clinic. So during the second visit, his blood investigation and urine reports were reviewed. So which are unremarkable. And also, patient was diagnosed with distress and anxiety due to recent bereavement and also progression of the parent's condition. So thereby, the doctor has suggested the patient for bereavement counseling and also artistic counseling, and also he needs to be having a meeting with the doctor in 1 month interval. So here we are writing a letter to a social worker to look after the patient, also to arrange a bereavement counseling along with the artistic counseling, as his mother is suffering with multiple sclerosis and he don't have a father because he was recently passed away because of the thyroid problem. So these are the reason that we are writing a letter to a social worker to look after the patient. So how we can write this letter? So here we can write the letter as usual. We are writing the date, which date they have given on the case note. Like for example, in the today's date, that is the date we have to write it on the top of the paper. Then we have to write the address. To whom we are addressing this person, that addressing person, that address has to be mentioned. And coming to the point of patient's name and date of birth. And then before that, you have to mention the salutation and then introduction. So here in introduction, you must mention the patient problem. So patient is suffering with distress and anxiety due to the recent bereavement and also progression of the patient's parents condition. So this is the introduction. So why he needs a social worker? So what is the purpose? Because here you have to write it, he needs counseling and support service from the social worker because she is the one arranging the counseling session for the patient. Now coming to the present medical history paragraph. So even instead of present medical history paragraph, we may write a social background because as we are writing this letter to the social worker, so we can prefer social background first next to the introduction. So the patient is like living with a mother who is suffering with multiple sclerosis and father is recently died, which means on December he died because of the thyroid problem, and also he has ADHD and he has been suffering with the autistic disorder since 2002 and he is on medication for the same. And patient has social withdrawal and also patient is suffering with the anxiety. So these all are the main important information which we have to mention in the social background. Then coming to the present medical history paragraph, that could be the third paragraph. So where you can write the first visit which happened on 2nd of January. So he presented with agitation and keep on saying about the father's death and also he was very anxious. So what we have done, so blood test and urine test has been done and we sent the patient home to come back on second visit. So the second visit happened on 9th of January. So when he was back to the clinic and the reports were reviewed and the reports were unremarkable. So thereby the patient was diagnosed and in the discharge advice, patient was for the patient, we have just recommended to the social worker to arrange for the bereavement counseling session and also for autistic. And apart from that, we need to have a meeting with the doctor monthly basis. So these are the recommendation was given to the social worker. So next thing is conclusion, and you're winding up the letter with a salutation. So in this letter, there is no much information to write it. Only the thing you have to concentrate on, what is the patient medical background and what is the current problem of the patient, how the social worker can support the patient. So this is a very simple letter. So this is about the social worker letter. Okay, so the next letter is, it's a known case letter, writing a letter to the patient GP. Patient got admitted in the emergency department due to the symptoms of cellulitis. So thereby patient has undergone blood investigation and also Doppler ultrasound of the patient. So in which the blood investigation revealed patient's WBC and also patient's CRP level was high. In the Doppler X-ray has revealed venous ulcer. So the patient diagnosis venous ulcer. So thereby they have initiated with 2 antibiotics and also compression stockings and also daily dressings. So these are the treatment has been given to the patient. So patient name is IV John, Mr. IV John, and he is admitted in the emergency department with the complaints of fever, nausea, symptoms of cellulitis, and also ulcer on the right ankle, and also there was the oozing with a purulent discharge and redness of the lower leg. So temperature was 39 and patient blood pressure was 170/80. So what they have done, patient has undergone Doppler X-ray and also blood examination. So which confirmed the diagnosis of venous ulcer, and the blood investigations revealed the increased WBC and CRP. So here patient has been initiated with the treatment of antibiotics, which was 2 antibiotics prescribed, and compression stockings was encouraged to wear for the patient, and also daily dressing have been done. And apart from that, the recommendation part, we are writing this letter to the patient's own GP. So here we can completely forget about the social background. So here we are writing a letter to the GP. So what we are writing is, the GP has to continuous monitoring of the patient own condition and also daily dressing, and encourage the patient to wear compression stockings and gradually ambulate with a walking frame. So these are other things that GP must make sure with the patient after the discharge. So here, as usual, date of writing a letter on the top of the paper, and the GP's address has to be written, and salutation, patient name is IV John, and then age of the patient. And now introduction part, you can write it. I am writing to update you regarding the current condition of Mr. IV John. Like that also you can write it, or else you can straight away you can write who is recovering from venous ulcer. Like that also you can write it. Either you can write, I am writing to update the current condition of Mr. IV John, who is recovering from venous ulcer, full stop. He requires your regular dressing and further management, or further no need, it's under follow-up care. Like that you can write. Next, coming to the point of your present medical history paragraph, that has to be elaborated since the day of admission to until the day of discharge, what all the treatment patient has received and how the patient has reacted to the patient. That all things has to be elaborated as much as possible, because here we are not writing the social background of the patient. So the present medical history paragraph can be written in the 2 passage. So you can start with like this, like Mr. John was admitted on so and so date, because I'm not quite sure about the date, admitted with the complaints of fever, nausea, and ulceration on the right ankle with the purulent discharge, redness lower part of the leg with a temperature of 39 degrees Celsius and the BP 170/80. Therefore, he has undergone Doppler X-ray and blood investigations, which confirm the diagnosis of venous ulcer, and the blood investigation revealed increased WBC and also CRP level. Therefore, he has been initiated, or he was commenced on 2 antibiotics and then encouraged to wear compression stockings, and he has been done with the regular dressings. Full stop. Now, recommendation paragraph, what the doctor has to do for the patient. So he has to do, it would be appreciated if you could continue the wound dressing and monitor for signs of infection. Second thing is, kindly encourage him to wear compression stockings. Then most importantly, recommend him to ambulate with a walking frame. So these are the recommendation things we have to write it for the GP. And then you're writing the conclusion and then salutation, you're winding up the letter. So this is also, there was no information to write it in the letter, because as you are writing to the patient's own GP, so we are just writing only the present medical history paragraph and the recommendation paragraph, what he exactly do for his patient. So here we are completely omitting the social background, which is not necessary because it is the patient's GP. He already knows what is the past medical history of the patient. Okay, I hope you all have done in a very good way. So because the both letters are really easy letter, one was a known and another one is an unknown letter, but there was no much information to write it. Only the important information we have to selectively we have to write it in our letter. Okay, so anyone is if anyone is wants to join in our class, we have 40 days, 60 days, and also we have 10 days class of writing and speaking. So whomever is willing to join in our class, our number has given in our description, so you can contact us at any time. So until then, bye bye.